Health officials are warning that after months of being shuttered, schools that are starting to reopen could face an unexpected health threat lurking in the water supply: Legionnaire's disease. So for more on this, we want to bring in Dr. Andrew Whelton. He's an associate professor of civil, environmental, and ecological engineering at Purdue University. Doctor, thank you very much for joining us. When I read about this, it was just another one of those, man, 2020 is really doing a number on us. Legionnaire's disease now. Officials found Legionella at multiple schools in Ohio and Pennsylvania this month. What is Legionella and how does it spread, and why is it a concern?
Well, thank you for having me. This is a really serious topic, and the detection of Legionella at 8 schools in the last week alone, 3 more yesterday, is a serious discovery. But one of the issues is that people are testing for it, and so that's why we're finding it. It's there, we just haven't known previously because we're not testing for it. Legionella is a bacterium that if you inhale it, it causes a lung infection if it's at high enough dose. And that lung infection can be fairly serious for people who have immunocompromised immune systems or prior smokers that have these pre-existing conditions.
So you said it's actually pretty common, it's just that we're not testing for it. So has it always been in the water supply in many schools?
Well, in the environment, it's ubiquitous. It's everywhere. And the issue really is that inside building water systems, it provides the opportune environment for amplification, or where it can basically multiply. Unfortunately, we haven't really done much testing in the United States about Legionella and building water systems, and there are no regulations that require either testing or disclosure of test results. So what you're seeing nowadays, especially in Ohio, in Pittsburgh, Pennsylvania, is schools are taking the initiative to do testing themselves because they want to take action to protect the faculty, staff, and kids.
So then what areas of school buildings, in school buildings, are you most likely to find Legionella?
In schools, you're generally concerned about 3 issues. 1, it needs to have warm water for the most amplification to occur. Legionella can grow in cold water. We found it in cold water recently in schools, but warm water is the opportune environment. Number 2, you want no or slow moving water. And so this allows the biofilms to grow, the slime layers on the pipe walls and tanks and faucets to grow more easily. In 3, you want little to no chemical disinfectant. And this chemical disinfectant, like chlorine, kills the organism when it tries to come out of the biofilm and get into the bulk water. So if you have that trifecta happening in your building, you have the potential for Legionella to be present.
So then is it really sort of combating this? Is it really a matter of just sort of flushing out the system, or once Legionella has been there for a while, a quick running of the taps is not going to do it?
So in our studies since the pandemic began, we've been going to schools across the Midwest, and we have found that if you flush out the water and there's high Legionella concentrations, the levels will decrease, but they will rebound. And so then there's a need to continually to maintain, bring in fresh water into the building that has chemical that keeps that Legionella at bay. So it's really managing the risk.
If it's something that typically isn't really tested for, but they're testing now, are there any regulations in place to prevent Legionella in schools?
Not to my knowledge, no. There's no regulations that require schools to test for Legionella or any other pathogen in the building water system. And there's some, maybe in the last several years, you've seen schools start to look for lead and copper, but definitely most schools generally don't do that.
All right, so then, you mentioned who may be sort of the most susceptible to it. I actually don't know anything really about Legionella, so let's go over it again. Just who's more likely to get sick, and what does that look like if you do get Legionella?
Right, so Legionella is a bacteria.
Not Legionnaire's disease, not Legionella. Legionella is what's in the water. Legionnaire's is what happens to you. All right.
Right. So you inhale this bacterium and it goes into your lungs and causes an infection. And from there, you have basically contracted Legionnaire's disease. Legionnaire's disease is a lung infection. It affects people that are generally 50 years or older, current and former smokers, people with underlying illnesses such as diabetes, kidney failure, liver failure, and also immunocompromised systems, people whose immune systems can't really fight off that infection that easily. One of the issues we saw in China was that there were co-infections. People who were susceptible to COVID also had Legionnaire's disease infections. And so that's something we're looking for here in the U.S. In Illinois, one of the individuals indicated that they went to get treated for COVID, and after 3 days of 104 temperature, the doctor figured out that it was actually Legionnaire's disease, and they treated him for it.
Oh, that is fascinating. And I did think, respiratory illness. I thought to myself, gosh, we were already trying to manage this one respiratory illness. It's very interesting that at a time like this, they could look very similar. Dr. Andrew Whelton, thank you very much.
Thank you for having me.